Welcome to an extraordinary exploration of the human body's limits. Imagine a world where you never stop eating. What would really happen if you ate non-stop? Let's dive into this fascinating and somewhat disturbing scenario. Firstly, let's understand how digestion works. When you eat, your body breaks down food into nutrients in the stomach and intestines. These nutrients are absorbed into the bloodstream and used for energy, growth, and cell repair. The process starts with chewing, which breaks down food into smaller pieces. Saliva mixes with these pieces, starting the process of digestion even before the food reaches your stomach. Now think about this process happening non-stop. Constantly eating would mean your stomach is always full, and your digestive system is continuously active. Initially, your body might handle it by speeding up the digestive process, but soon it would struggle to keep up. The stomach and intestines are not designed for continuous digestion without rest. Continuous food intake would likely cause the stomach to expand beyond its normal capacity, leading to discomfort and pain. One of the immediate effects of non-stop eating would be severe indigestion and discomfort. The stomach would be constantly stretched, leading to pain and bloating. Over time, this could cause more serious issues like gastritis and inflammation of the stomach lining. This condition is painful and can lead to ulcers if not treated. Gastritis can result from the continuous production of stomach acid, which, without breaks, begins to damage the stomach lining. But the problems don't stop there. Continuous eating would overload your pancreas, which produces insulin to regulate blood sugar levels. With a constant influx of food, particularly carbohydrates and sugars, the pancreas would be under immense pressure to produce insulin. This could lead to insulin resistance, where the body's cells become less responsive to insulin, paving the way for type 2 diabetes. Insulin resistance is often a precursor to type 2 diabetes and can cause persistent high blood sugar levels, which damage various organs over time. Another organ that would suffer immensely is the liver. The liver processes nutrients and detoxifies harmful substances. Non-stop eating, especially of unhealthy foods, would flood the liver with fats and sugars, leading to fatty liver disease. This condition impairs liver function and can cause long-term damage, potentially leading to liver failure. The liver's role in metabolizing fats and sugars means it would be constantly overworked, resulting in fat accumulation within liver cells. Let's not forget the cardiovascular system. A constant intake of food, particularly high in fats and cholesterol, would lead to plaque buildup in the arteries. This condition, known as atherosclerosis, restricts blood flow and can cause heart attacks and strokes. Moreover, continuous eating would likely lead to significant weight gain, putting extra strain on the heart and increasing the risk of hypertension or high blood pressure. Hypertension, coupled with atherosclerosis, significantly raises the risk of serious cardiovascular events. Then there's the issue of nutrient overload. While it's common to worry about nutrient deficiencies, having too much of certain nutrients can be just as harmful. For instance, an excess of fat-soluble vitamins like A, D, E, and K can lead to toxicity. Hypervitaminosis A, for example, can cause liver damage, hair loss, and blurred vision. Too much vitamin D can lead to kidney damage due to high calcium levels in the blood. These vitamins accumulate in the body's fat stores and can reach toxic levels with continuous high intake. Beyond the physical health issues, continuous eating would also have severe psychological effects. The act of eating is often associated with pleasure and social interaction. However, if it becomes a never-ending activity, the pleasure associated with eating would diminish, and it could become a compulsive behavior, leading to food addiction. This could severely affect mental health, causing anxiety, depression, and a distorted relationship with food. Food addiction can result in a cycle of binge eating and guilt, exacerbating mental health issues. Now, consider the impact on your daily life. Continuous eating would consume most of your time and energy. Activities that require concentration and physical movement would become challenging, if not impossible. Your social life would suffer as well. Meals are often social events, but if you're always eating, it would be difficult to participate in other social activities, leading to isolation. The time and focus required for constant eating would leave little room for hobbies, work, and social interactions. Furthermore, your sleep would be affected. The body needs rest to repair and regenerate, but if you're constantly eating, it would disrupt your sleep patterns. Eating late at night can cause acid reflux and heartburn, making it difficult to sleep. Chronic sleep deprivation has numerous negative effects, including impaired cognitive function, weakened immune system, and increased risk of chronic diseases. The lack of restorative sleep would further strain your body's ability to cope with continuous food intake. The gastrointestinal tract, responsible for moving food from the stomach through the intestines, would be under constant strain. This could lead to severe gastrointestinal issues like irritable bowel syndrome, IBS, characterized by abdominal pain, bloating, and altered bowel habits. Chronic overloading of the digestive system might also increase the risk of gastrointestinal cancers, as the constant cell turnover and inflammation could lead to mutations. The continuous presence of partially digested food in the intestines can disrupt the gut microbiota, leading to further digestive complications. Let's delve into the metabolic consequences. The body's metabolism is designed to handle periods of eating and fasting. Constant eating would disrupt this balance, leading to metabolic syndrome. This condition is a cluster of symptoms, including increased blood pressure, high blood sugar levels, excess body fat around the waist, and abnormal cholesterol levels. Metabolic syndrome significantly increases the risk of heart disease, stroke, and diabetes. This syndrome results from the body's inability to properly manage the constant influx of nutrients and energy. Moreover, constant eating could lead to nutrient imbalances. The body needs a variety of nutrients in specific amounts, and overconsumption of certain foods could crowd out others, leading to deficiencies. For example, excessive intake of simple carbohydrates might result in insufficient intake of fiber, leading to digestive issues like constipation and diverticulitis. Fiber is crucial for healthy digestion, and its deficiency can cause numerous gastrointestinal problems. Hydration would also become an issue. Many foods are high in sodium, and continuous eating would increase your salt intake, potentially leading to hypernatremia, a condition where the sodium levels in your blood are too high. This can cause severe dehydration, as the body tries to balance the high sodium levels by retaining water. Dehydration affects every system in the body, impairing kidney function and reducing overall health. Your body's hormone levels would also be affected. Ghrelin and leptin, the hormones that regulate hunger and satiety, would become dysregulated. Ghrelin levels might remain constantly high, making you feel hungry all the time, while leptin, which signals fullness, would become less effective. This hormonal imbalance could perpetuate the cycle of continuous eating. The disruption in these hormones can lead to perpetual feelings of hunger and dissatisfaction. And then there's the financial and environmental impact. Constantly eating would require an enormous amount of food, leading to significant financial costs. Moreover, the increased demand for food would have a substantial environmental impact, including higher carbon emissions, greater water usage, and more waste production. This would contribute to environmental degradation and exacerbate issues like climate change and resource depletion. The strain on global food resources would be immense, highlighting the unsustainability of such a lifestyle. In conclusion, while the idea of eating non-stop might seem like a dream to some, the reality is far from pleasant. The human body is not designed for constant consumption, and the consequences of such behavior would be severe, affecting nearly every system in the body. From physical health issues like digestive disorders, diabetes, and heart disease, to psychological effects like anxiety and depression, the toll would be immense. Not to mention the impact on daily life, sleep, finances, and the environment. So, while it's important to enjoy your meals, remember that moderation is key to maintaining a healthy and balanced life. Thank you for joining us on this journey into the extreme scenario of non-stop eating. We hope this exploration has given you a deeper understanding of the incredible complexity of the human body and the importance of balance in our lives. Until next time, take care of yourself and remember to eat wisely.